Okay, so as promised, we're going to take you on a little tour of your knee. You're going to see this as we do, so we haven't gone around and looked yet, so there's no editing. But this is the kneecap above, okay? You see a little fissure right there in the cartilage, okay? Now that's just patellochondrosis. It's pretty common for most of us to have, but we'll get a little better look at that here in a second. So this is the groove below, okay, and pretty much looks pretty good. All right, it's nice and smooth white cartilage. To the right over here, you see something hanging down here. That's kind of in the area where the patella tendon starts to come in. So as I back out, we're looking at the inferior part of the patella, the bottom part right there. And this is the area kind of coming right in here where we think it's bugging you. See that? All right, so that's what we're kind of here to see, and we're seeing what we kind of thought we'd see. All right, so not hateful looking, all right, but enough to give you, well, at least that's what we're hoping, is to give you your problem here. Okay, so as we swing down in here, we're going to show you the rest here. That's the medial meniscus there in the corner. It's a little cloudy because I don't have another outflow yet here, but we'll get that here in a minute. Trying to get our focus up, but all right, there's the articular cartilage there. We're going to swing past this a minute, and your ACL is living back here. But all this plica stuff in the middle, this is behind the kneecap as well, so not always symptomatic, but in you, we're going to take this tissue out because it's sitting right in that area where you're hurting. The ACL lives behind there, as I can show you that here in a minute. And then as we swing into the lateral compartment, this is the lateral meniscus there, kind of in the center of the screen. Again, none of this, we expected to see a problem, and we're not, so that's all good. The articular cartilage is there, nice, smooth, and white as it should be in your age, okay? So we're swinging back to the middle, so now we got to get our working portal in, all right? And this is going to give us a little bit of a view of the rest of your knee here. So this is our little knee. I'm going to go a little wider. All right. So we're out of our way. So again, now we're going to make another little small incision and get our little working device in here. All right. So this is the synovectomy part, okay? Again, none of this is going to look like drama. So we're going to get this plica band out of the center of your knee. This is right behind your patella, okay, patella tendon. This tissue is, but as I said, now this fat pad here is the Hoffa fat pad. Again, not an uncommon place to get impingement. So we're going to take this back, this yellow stuff here, up to that patella tendon area, okay? So this will roll back, all right? So if it's not pathologic, we're not hurting you, it helps us see a little bit better. And this is the backside of the patella tendon right here. So this is exactly what I thought we'd see, is this kind of frayed up stuff right here. Okay? And it's already kind of loosely coming in here. So this is where you're hurting, up kind of toward the top center of the screen. Okay? And I told you, I promised you I'd show you your ACL here, so we'll do that. And that's that shiny structure right there. Okay? So that's normal looking as expected. Now, the one downside of messing with this synovial tissue is it likes to swell. So there's a possibility you might get a fair amount of swelling. So ice is your best friend. Compression, if you can do that, better yet. And really try to control the swelling, because when you get a fair amount of swelling, what it can lead to is delayed quad reactivation, and in your sport, that's a slowdown. Okay, so I'm going to swing back up here, and we're going to go right up behind the patella tendon right there, okay? So that's what we were kind of expecting to see. So if I put a needle in where you said it hurt from the outside, see if we can localize it. We're right, a little too low, I missed your spot there. Right there is where you said, right on the bottom of the patella. You see where that's coming in? Okay, so that's where you were putting your finger where you said it hurt. So this is the tissue right here that we kind of expected to see again on the back side of the tendon. And we're just going to take this back to what we think is healthy tissue, okay? We don't want to get into the structure of the patella tendon if we don't have to. That's not going to bode super well, all right? So the good news is we're finding what we thought we'd see. And I'll need the Arthro wand if you... And we're doing what we said we were going to do, and then the hope is that I always tell people, you'll let us know down the road if we got the right plan or not. So I'm going to go in with this thing called the Apollo. You can bend down a little bit there. There you go. And again, we're right off of the patella. So right here is where you're hurting. Okay, see this stuff right here? And this is where I like this procedure, or we've liked this procedure, is we're seeing what the MRI was supporting right in there. Give me the shaver back a minute. Again, right off the bottom tip of the patella there. And then again, your dad was asking about balance issues and posture stuff, and I think that all plays into it. And that's probably what, and if Steve's watching this, you're going to want to talk about doing at some point is a functional movement screen. And that's where you can kind of look at all this stuff together in kinetic chain form, and that's a good off-season thing to do. All right, let's have the buzzer a minute. And we can either do that at school or to one of our sports performance places. So again, inferior polls patella right here. Right here is where the MRI was a little abnormal. And this is a little ablation tool. Get that a second. There you go. So now we got to get this all to kind of heal back normal, okay? Now again, you're going to go back to the same thing that got you here. You've already kind of proven that you're a little prone to re-aggravating things. So I think Dad's on target. We got to kind of figure out for you what the culprits are and if they're fixable by other means, meaning rehab or orthotics or something along that line. Okay, so again, now we're moving over a little toward the lateral side over here, toward the outside of your knee. And again, this is the patella. This is the patella tendon on the back side where we had removed that, what we thought was at least injured tissue there, or at least debriding it. Okay, in the old days, we'd make an incision on the outside, take this whole piece out, okay? Not the old days, I'm not that old, but in times gone by, back before color TV, Bluetooth, the internet, and all that. But that's what we would have done, and it'd be, like I said, it'd be like a mini ACL harvest. Okay, so what we're going to do now is we're going to drain the knee. Keep it up there a second so I can see kind of the spinal needle. So I want to get this. This is the PRP part of this. We can inject through here, right? And I'm just going to make a few little mini 10x holes here, okay? And we want to get right in the area, okay? So I'm not going to go into the knee. Well, I'll start in the knee. We're going to inject it into the soft tissue here. All right, so put the, let me drain it like I said here. So we're going to get our water out. You got the syringe? You know the PRP yet? We're still spinning. Oh, we're ahead of the game. Okay. All right, so we're a little ahead. We're still waiting on the PRP to spin down. So what we're going to do, and then I'll finish the taper, is we're just going to pull this back once we get the injection so we know we're in the area and kind of pepper that in there. Up, here it comes. You won't be able to see it, hopefully. Well, you'll see a little bit of it leaking out, but we want to be in this tissue, not into the knee. So actually, we got a nice draw, so we may put a little in the tissue and a little in the knee. All right. We're going to back it out here a little bit. And let's hold that just a second. I'm going to see if I can get as much more of that fluid out of here as we can. So we're not going to be able to see as well once we lose all of our fluid from the knee, but we know that's why we want to localize that now. You can see it gets kind of cloudy, but we know we're in the spot we want to be in. So I'm going to inject, inject, inject. Okay. All right. And then we'll probably put a couple cc's. There we go. So again, you can't really see much with this, but all right. Well, have fun going back up to. I forget where you're going. Can't say it. I'm not allowed to say it out loud. The TTUN state, TTUN, the team up north. Is that what we call it? That's okay though. Somebody's got to come in second. Just kidding. All right, so that's it. All right, so we'll track you down over the weekend. Make sure you got home in one piece. I'll let Steve know if that's okay with you. If not, I probably already let him know. So, and then we'll see you when you get back in town, okay? So if the video can go to your therapist, I think this will help them a fair amount. For their sake, there's really not a restriction here. You're really treating a patellotendinitis or patellotendinosis, so it's range of motion, quad activation, swelling control early, probably for the first at least 2 or 3 or 4 weeks before we start stressing anything that way, and then that'll happen back here. So it's kind of a increased activity as tolerated thing, and the as tolerated part being the key to that. All right, we will see you in a couple weeks. Have a good holiday. Bye. Is it even on? Did you turn it? Okay. Oh, I don't know. Can you, I don't know, we're seeing our video still on, but I'm not sure if we're recording. Were we recording?